111, prevalence of spinal deformities and myelomeningeals treated in utero and postnatally using 3D EOS panoramic X-ray technology by Dr. Mildel Benitez. Thank you.
So this is my PhD research, the prevalence of spinal deformity in myomeningeal cell treated in utero and after birth using the EOS 3D imaging. Here are my disclosures. So this research is based on 4 pillars. The first one, myomeningeal cell. This is the most common neurotube defect among several others. The second is the surgical treatment of myomeningeal cell that is traditionally made postnatal. And from the 90s, at the end of 90s, the in utero surgery was presented, the fetal surgery that we call. The third pillar is the neuromuscular scoliosis that is present in almost 70% of patients with myomeningeal cell, and in sacral defect, only 20%, and in the defects above T12, 94% of patients. This is much more important in the non-ambulatory patients than in ambulatory patients. And the fourth is the EOS, the external orthopedic system that offers a low dose radiation for those patients, and not only the dose, but also the quality is very high to perform the evaluation of those patients. The objective of our study is to analyze the prevalence of spinal deformities in patients who underwent intrauterine myomeningeal cell repair, comparing them with patients who underwent postnatal repair. We evaluated 469 patients in January 2006 to 2021, and 70 patients were included. 47 in the fetal group. There is 47 patients treated in utero and 23 patients treated postnatal. We had many findings that are in the literature. For example, lower prevalence of urinary incontinence, 27% in the fetal group and 6% in patients postnatal. Ventriculoperitoneal shunt, 20% in the fetal group and 65% in the postnatal group. But this is the most important finding of our study. At birth, 38% of fetal group has scoliosis and 34% in the postnatal group. That is okay, almost the same. But when we perform the EOS, 48% in the fetal group and 69% in the postnatal. But the number was not statistically significant. But when we compare the evaluation, the development of those patients, so 10% developed scoliosis in the fetal group and 34% developed scoliosis in the postnatal group. And this number is statistically significant. Our research was the first one to show these findings. That is, scoliosis should be prevented in patients suffering a fetal surgery. And this paper from 2022 showed some numbers that is very interesting, like the 1-year-old patients has the same scoliosis prevalence, and in 30 months there is a small protection for those patients that were treated fetal. But this number was not statistically significant. We have our hypothesis. There is 3 main hypotheses. So early release of the tethering cord may reduce the onset of spinal deformities. The greater the problem, the defect, higher the incidence of the problem, and the exposure of the amniotic fluid and mechanical trauma to the spine cord inside uterus is a big problem to the neural death and loss. In conclusion, the analysis using 3D X-ray technology showed a lower prevalence of acquired scoliosis in the fetal group, suggesting a protective effect of early surgical intervention. Thank you.